Hi, I'm Janet. I'm a nurse here in the emergency department. This is Alex behind me. We're practicing social distancing.
Hi. I think right now it's the most powerful tool that the general public has to prevent the spread of this disease. So if we look at New York, Massachusetts, and around us, we're a little bit ahead of the curve, and it's right now that everybody has to be as careful as possible. Good hand washing, stay away from each other as much as possible, thinking that we're protecting each other. That's the best defense we have right now because there's no good treatment for this disease. You don't want to get it and you don't want to give it to anybody else. So be as careful as you can.
This whole COVID thing is pretty legit and people are getting really sick. So you guys need to be smart about it, and having these parties and doing the things that you guys have been doing are pretty unsafe. So I don't want to see you guys here as a patient. So practice good social distancing.
So overwhelming likelihood if you are young and healthy is that you will not be severely ill with this disease. The problem is that doesn't hold for everyone. So if you're out there, even if you have mild symptoms or no symptoms and spread it, think about your parents and your grandparents if they get it and end up on a ventilator.
My name is Emily. I am a nurse in the ER EVM.
Yep.
And I recently had a trip planned to Nepal, which was canceled due to the COVID outbreak. And so I thought, well, maybe I should go home and see my family. And it turns out I can't go home because my dad is 74 with asthma and cancer. So even though I have not seen him in about 6 months and he is fighting cancer, I have to make the choice not to go home to see him. So that is
Are you scared?
I'm very scared.
Yeah.
Scared for him and everybody else who's not taking this seriously.
I'm scared because I feel like I'm actually the person who is a factor in possibly spreading this. So I was supposed to go home to see my family. I haven't seen them in 6 months like Emily, and now I can't because my grandmother also is in remission from cancer, and I really miss her, but I don't want to get anyone else infected.
I am nervous. I'm nervous for a few reasons. I like to think that as an ER nurse, we're supposed to be calm and collected, but I do have this sense of fear when I go home. I get nervous that we are going to run out of supplies when we get this influx of patients, and that we're here taking care of people, and then once we do run out of supplies, what's going to happen? We're going to catch it inevitably, and then we're going to pass it on to our family and potentially injure or even kill someone that we love. Inadvertently. That's really scary, frightening. Honestly, if you're not social distancing, it's really a huge slap in the face to healthcare workers everywhere, the ones you know, the doctors, the nurses. We're out here putting our lives on the line, and yeah.
It's frustrating. It's frustrating. We see people who come here and who are really sick, and we come every day to help people, and we're asking people to stay home and try to keep the people in their community safe, and it's frustrating to see that people can't even do that to help.
I think it's going to be really important. We are going to be really overrun with people who are sick with this disease if people are continuing to give it to each other. One of the really big problems with this virus, the COVID-19 virus, is that a lot of people who have the virus are not symptomatic, meaning they don't have a fever or cough, but they're still spreading the virus to everybody else. So even if people are feeling good, they're still giving it to each other. And then another problem is that people are starting to shed the virus even before they have any symptoms, meaning that you are contagious before you even feel any symptoms if you are going to feel symptoms. So please stay on your own. If you need to be social, please arrange a online virtual meeting and have your ice cream sundaes on your video chat, but please try to stay apart physically.
I think that we all have a role to play in this. Us here are missing out and putting our families at risk, working long hours, and you at home, your job is to stay isolated and quarantined as much as you can, stay healthy so your friends can stay healthy and your family can stay healthy. It just decreases the amount of people that have to come to the hospital, and it increases our ability to care for those who are really sick with the virus right now. I understand there's a huge fear of missing out, and that's a real thing, especially for younger generations, or maybe all generations. But it's one thing that you can do while you're staying at home to make everyone else's lives a little bit easier, maybe a little bit healthier. I think we're all anxious to some degree. We're all looking forward to the light at the end of the tunnel. But for most of us here, I feel like we're in a calm before the storm, and it's going to get much worse before it gets better.